Well, basically what we do is like what every other doctor would do. It's a history and physical. We sit down, we listen to you, we let you tell your story. Then I ask specific questions about what your condition is, and then we do a physical examination. In the orthopedic office is almost always accompanied by x-rays. Sometimes we review outside x-rays or MRIs, and then we come up with a conclusion and a treatment plan, and that may or may not involve surgery. So basically what distinguishes my office, I think, from most is that I think it's so important to take the time with the patient that every doctor will say that, but in this point in my career, I don't have to do as much as possible. I want to really do it as well as possible. So that usually means, especially for people that have had a problem that was rejected elsewhere, or that other doctors could not bring to a resolution, or the people that come from far, far away, is that we might take up to an hour if necessary to go over everything, explain everything, and try to address everything. I guess it's primarily the fear of the unknown, I would say, and therefore it's so important for a surgeon to explain what it would all involve, what to expect, and how long it's going to take. I oftentimes tell people that your average hip or knee replacement takes less than an hour, and they're usually surprised and happily surprised because they think it takes all day to do that. No, sometimes less than 45 minutes. So it's not that big an operation anymore. And then people are oftentimes have fear of pain, very understandable. And so then I explain that our modern day methodologies, both as well as technique as well as medications, make it much less painful than it used to be. In most cases, that people that evening already are sitting up, watching TV, reading a book, and even get a little bit of physical therapy. The very day you have the operation, you get up and walk a little bit. Some people even go home that same day. In the world of orthopedics, the advancements are ongoing, and as an orthopedic surgeon, that's really, really exciting. And there's so many different advancements that I almost do not know where to start. So the area of joint replacement surgery really came about in the 60s. And that's for hip replacement. In the 80s, they started doing knee replacements. And at first, it was possible to do those operations. At the very beginning, people were admitted to the hospital 7 days in advance. Can you imagine that, just to prepare them for that? And then they would stay another 2 weeks after surgery or so. Nowadays, you come in the very morning off, and most people are home within 24 hours. And one huge step forward was the introduction of robotic surgery. And what that really entails is a more computerized approach in the planning and mapping of the knee. So as you can imagine, to a certain degree, replacing a knee or a hip is similar to carpentry. Bone is similar to wood, and we shape it and we attach things to it so as to restore the joint that is not healthy enough to function anymore. Well, so the planning of that operation in terms of sizing and positioning of the components has taken a quantum leap forward with the introduction of computer technology, by which we now can map the hip and knee and create a three-dimensional model on the computer. And on that model, we then identify the disease and the deformity, and we adapt the component, what we're going to implant into your body. In effect, do a whole operation on the computer, on the model of your body, so we in advance know exactly what to place and where to place it, and how it interacts with your body. So that's fantastic technology. And then we use computers and even robotic arms in the operating room to accomplish the precision. So the net effect of that is that our ability to be precise and get the implant in exactly in your body where it belongs has greatly been improved. And now we have objective data. We can, during the operation, measure the tightness of your ligaments, as opposed to just guessing at it like we did in the past. Oh, that's a good question. So I still have patients nowadays that come in for an unrelated problem, and I say, hey, didn't I replace your knees? Yes, doc, it was 25 years ago. Oh man, it's awesome. We got a picture to look at them and they're still doing good. So it is possible, even with the technology that we had way back then, to get a result that lasts for a couple of decades or more. And as a matter of fact, nowadays, with the quality of the material and the techniques, that's really what we expect. So the idea is to get as long a result as possible. So when you're in your 60s or 70s and get a joint replacement, it may very well be good for the rest of your life. Now, some people are in an unfortunate situation because of whatever childhood disease or injury that they get a joint replacement early in life, and so we just follow those people closer. When I was in medical school, I met a couple of guys, and I played guitar a little bit, and they said, well, come join us, and one thing led to another, and before I knew it, I was standing on stage in this band called CHICKWEED in the Netherlands long time ago in a galaxy far away. So I did that for a while until the responsibilities of medical school got in the way, but for a while I got a kick of being on stage and being a little rock and roll star. No star whatsoever, but I sure enjoyed doing it. And then I don't know if you know this story, but there was always my dream to capture a woman's heart with the guitar, and I did. So when I met my wife Candice, when it was my birthday, made me a fantastic meal, and I thought a few months later it was her birthday, so what can I do to impress her? So I did a guitar concert. I had a song from every continent where I'd lived with a matching meal, a bite, and a matching wine, and a matching song, and a little handout that explained it, and then I had a little introduction as to why I played that from that continent and how it reflected on who I am as a person. And so at the end of the evening was our first kiss.